Hey guys, Don here. Welcome to Podiatry Practice Mastery. I'm going to go over the $1,000,000 minute. These are the things that have helped me in my practice to go to the $1,000,000 mark and beyond. Talk a little bit if you've been listening before. My dad is living with us and dealing with some issues, but I have a couple of good things that happened yesterday or this day. I'm recording this is for on a Thursday. I had a half day in the office because I had to bring my dad to a neurologist, and we did this cognitive testing, and I tell you that was a little bit challenging to see. I don't know much about dementia, but he has a little bit of a challenge processing and I think remembering as we know things. So they're going to do more testing. But I also feel good that we switched his address. It is such a challenge to switch the Social Security number address, which then switches Medicare. But what I didn't realize is since we switched his address at home, it actually updated automatically to Medicare, and I only needed to wait on the phone for 1 hour and a half with Social Security to learn that. And then the other good thing is we actually have all the paperwork done for the adult daycare for him 3 days a week. So I'm kind of excited about that. That he's kind of getting some help and it'll get some respite for my wife. So since it was that way, it was only 10 patients for the day. So first one was a 33-year-old gentleman that has plantar fasciitis bilaterally, and so he is on Shockwave number 4 out of 6. And this was the one that we only charged him half because the staff wasn't paying attention. So if you're going to do a lot of Shockwave or a lot of cash payments, you kind of need to check to make sure the staff are doing it. Now, he ended up paying, right? And then people sometimes ask, "Oh, do you discount if it's bilateral?" Well, if they ask me, I will, but it's just it's the same amount of work, and if they don't ask, I don't offer, right? Because it just takes as much time. So I did 4 out of 6, and that was one, and the other one was another patient. She was a 69-year-old for plantar fasciitis as well. She had Shockwave number 4 out of 6 as well. Next patient was a follow-up patient. Over 3 years, so you probably know this, but I'm just telling you. We categorize our patients as established patients greater than 3 years or less than 3 years. So if it's been greater than 3 years, they're considered a new patient, theoretically. If it's been less than 3 years, they're just an established. So this would be kind of a new patient visit. We did a diabetic foot exam. She had neuropathy. She had like a leather feeling to the front of her foot. We a lot of times have patients come in like that. And this is one that I talked about some of the topical things, capsation, biofreeze, and she was already given Cymbalta by her other doctor. And I'd also talked to her about Qutenza, and I'm going to check about Qutenza for her because she's a little bit concerned about some of the complications with the oral medication. Next patient was a 64-year-old with 6 out of 6 Shockwave. So whenever I do my last Shockwave, I do a level 3 office visit for them because I'm kind of planning what's next. I use my treatment sheet, that 6th treatment sheet that I print out, or the last fungal treatment sheet. If you don't have those, you can go to Podiatry Practice Mastery down on the bottom. There should be something that says treatment sheets, or if you don't, just email me. I can send you. But this is something that I feel it justifies an office visit at the last Shockwave. And it's just something visually that I can give them so they know what's next. Next patient was a 69-year-old patient that had an IND on the side of the toenail, so we did an office visit and IND. She also has some neuropathies from some chemotherapy, and there's not much, like Qutenza you can't do for that, so I just recommended some topical things for her. Next patient was a 52-year-old gentleman that was interested in Lunula. Now, I want to be clear. I tend to talk more of my patients out of Lunula than into Lunula. Yes, I do have Lunula, but I don't find it works as well. I'm sorry if you are Lunula advocates. I still think terbinafine works better. So he got his prescription of terbinafine, and I'm going to see him back in 3 months. He actually had his own LFTs, so I was able to look at his LFTs on his MyChart through his doctor. So I reviewed those other outside resources. And actually, if anyone super duper is listening to this and loves Lunula, please tell me what I'm doing wrong. I have a kind of an extensive protocol of 6 treatments and things like that, but I just don't see the benefit. Maybe it's my patient selection. And I know some people do Lunula with terbinafine together, and I just feel like, well, if terbinafine is going to work, why do you need to add the Lunula to it? That's just my thought. But if you love it, and maybe I'm doing it wrong, or something like that. So I'm kind of struggling with that. That I would like to learn to do that better. Next would be another patient. He was a matrix patient. This is a new patient with an ingrown. Another was this is a status post 6 shockwaves. She was 51-year-old. She is about 90% better after her Achilles tendon. I think sometimes when you're doing a lot of shockwave, you have to plan expectations for patients. So I don't ever say at the 6-week follow-up they're going to be 100% better. I'm hoping like 60 to 80% better, and that's good for me. And especially with Achilles, the two things that I look at when they're stabilizing, let's say it's on the right side, if they're stabilizing on the right when going downstairs and then they go down with their left foot, that's a good indicator in my opinion for patients. And then doing like a right-sided just single leg jump, like hopping on the right side. But she's about 90% better. I'm going to see her back in 3 months. Next was another girl. She's a 24-year-old. So this is a patient, these are kind of a challenging one. I think they are. On her right hallux, she was wearing high heels, and she noted some swelling at the base of her hallux nail. She had a little bit of swelling down there, almost like a retronychia. No pus, but just swelling and indurated. And there's a little bit of onycholysis to the distal half of the toenail. On the left foot, a couple of the nails are thickened, so I did a nail sample on the left one, possibly has some fungus. But I find these retronychia ones, or the swelling at the base, not full-blown infected or anything. Those are challenging ones to treat. You have to get that swelling down, and sometimes the best way is just to avulse the nail. If you guys have any other good ways of dealing with those onycholytic nails, hopefully it'll just grow out and reattach because it's only half of it. I did talk to her about possibly using Onifix on there to attach to the attached portion, so as it grows out it'll reattach. And I also talked to her about possibly avulsing the nail, but for a little 24-year-old coming into summer wearing sandals, it's not a good option. And then finally, this was another patient, status post 6 out of 6 shockwaves. She was super duper happy. She's feeling great. She did everything that I asked, and so super happy about that. Okay, so that was the day. Give you a little follow-up. Al, I did end up hiring Al. Al is going to be doing a weekly newsletter for me, so he's basically going to write things in my voice and put them out in a newsletter. So this is going to save me substantially for time, but I think it's going to give more value to those. So if you're not getting my emails, which previously had come very rarely, hopefully they're going to come a little bit more frequently. Also, I want to appreciate those that sent some emails. I got some emails recently from people saying, "Hey Don, don't stop doing these daily ones. These are helpful for us in our practice." So hopefully these are helpful for you. You're getting benefit. Hopefully you can implement things. If you are implementing things, let me know. And if you have other things that you hear me saying that you disagree with or that you do differently, please let me know, because that way I can share it with others and I can get better and more profitable in my practice. So I think sometimes we don't know what we don't know, and I'm always willing to learn and want to learn. Also, I'm thinking about I go to like this gym. It's not like the CrossFit. It's like CrossFit for middle-aged men. That's what it is. It's called the Fitness Asylum, and they have this cool thing where they do these like boot camps. I do a boot camp a couple times a week. And then occasionally they have these challenges, and I kind of like that approach. And I'm trying to figure out a way if there's a way we could do something in our practice. Is kind of like having a boot camp. I don't know if it's a boot camp, maybe like a live conversation via Zoom, where we can kind of focus on one aspect of our practice, or even having like a challenge, like they do these weight loss challenges. I was thinking maybe we could do like a practice challenge. And somehow, I don't know, maybe we could measure our numbers 1 month and try to increase it to the other month or something like that. So if you guys are interested in something like that camaraderie and kind of working together towards a goal and things like that, let me know if that's something that's interested to you. Send me an email, donna@podiatrypracticemastery.com. I'd like to do those things. I'm a little intimidated because I've never started them, but I think it would be fun because I find that at the gym that camaraderie with other people, it works a little bit better. You push yourself a little bit harder, being accountable to other people. I was thinking like a simple tracking system, maybe like in a Google Doc, how much you produced each month. Maybe comparing years, or I'm not exactly sure. Maybe we could just do it based on orthotics or on Shockwave or something else like that. Okay, those are the ideas for today. Hope you guys have a great day. Until next time.